understand the plight of persons with hearing impairment and, of course, what they go through following the pandemic, of course, stringent measures being taken by the government. How are they coping with this in this environment? So in studio, actually, at the far end is Henry Maina. He has hearing impairment, so he cannot really hear what I am saying. That's why I am here with my colleague, Lensa Odingo, who will be helping me communicate with him. So most of the time you'll be seeing Henry looking at Lensa because he has to get what I am saying through Lensa. And also, as I ask him questions, Lensa, as you can see, is trying to tell him what exactly I'm saying for us to be able to communicate. So he will be answering the questions through Lensa. I hope you now understand that. And of course, keep it here so that we really understand what this special group of people are going through, the challenges, even as they try to comply with the government's measures, talk about the curfew. Most of them have businesses in town. What exactly is happening with the communication because they have now to put on their masks? What are some of the struggles that they have to go through? And Lensa helped me tell him that I am really grateful that he made time to be here tonight. Thank you so much, Henry, for really choosing to be here this time of the night. I highly appreciate. All right, so let me begin by maybe giving us an introduction of yourself, telling us how this began, probably having a problem with your hearing. Is it something you were born with or it developed when you were young?
Thank you very much for this invitation. My name is Pastor Henry Maina. I'm deaf, but I was not born deaf. I was born hearing, but I was about 12 years old. I became sick and I suffered meningitis. It meant that for the past 33 years now, I've been living as a deaf person. I work at the Adventist Church, the SDA Church, as the pastor, and I teach her, and sometimes I help advocate for deaf people's rights. I'm married with 2 children. Yes.
All right, thank you for that. And of course, Henry, you can tell us how you were able, because you said you were not born with this problem. It developed when you got ill with meningitis. Probably you can tell us when the news were broken to you, how did you take it? Now you're saying you're having many businesses. How did you move on with your life now, coping with the new changes that now you cannot hear what people are saying?
Okay. Before I became deaf, I never knew that there are people who are deaf. I never knew. I thought all people are hearing. So when it happened to me, I thought maybe it was a dream. I thought that maybe tomorrow I'll be able to hear and use my ears well. But weeks, months, and I found that actually it's true that I have a problem with my ears. It's impossible for me to hear. So there was a lot of confusion in my mind. I could hear noise from the past. People would talk. People would sing. I would hear the car hoots. And my head, so there was a lot of confusion. It made it impossible for me to focus on everything, just working on my mind only. So I felt, the first thing I hid from people, from my friends. I refused to go to school. But it took a long time for me to accept my condition. I accepted myself. It helped me to move forward. But it was not easy. It was so hard. It took a lot of care and encouragement from my parents, relatives, and also my new school for the deaf people and the children helped me a lot to accept my new condition.
All right, and thank you so much for that background. Probably now, Henry, let me welcome you to our conversation on the plight of the persons with hearing impairment at this time that the world is struggling with coronavirus. Probably just tell us, how did you get the news that now there is coronavirus in Africa? And finally, when the president was announcing the first case of coronavirus, where were you and what means did you receive the news?
The first time this news broke, I was home. I was able to watch the TV. The TV had an interpreter. And there was the footnotes and the captioning. So I would see the interpreter. But when the coronavirus started spread and it continued, I found it was a challenge because the government want to use only an interpreter, but they don't want to use a deaf person. Maybe if a deaf person was called and told to explain clearly about coronavirus, what the deaf people need to do to protect themselves, it wasn't there. Up to today, the deaf people have the same concern. Yeah.
All right, and we'll be talking about those concerns. Probably, Henry, now we've been seeing the government take measures. And remember, you are a pastor. Probably when the news was announced the next Sunday, how were you? What did you tell the congregation? Did you sensitize them on how to avoid this, getting this coronavirus? And because you're mentioning the challenges of getting this information, probably tell us how you informed your congregation or steps that you took to just also protect the people that you are pastoring.
Yes. The first few days, we were able to meet. Why? The deaf people are always a social people and they love meeting. The churches, the schools, everywhere they like meeting. But as time progressed, now it was announced that we have to avoid and keep that social distance. It brought problems to the deaf people. Why? Information about corona did not reach the deaf people very well. Example, when you rely that interpreter on the TV, it's very small, the caption is very small. So it's impossible for the deaf to concentrate so much on the caption, they become so tired. Some deaf people are not able to read the captions very well. And also the deaf people, they have low reach to social media, Facebook, WhatsApp, and other different social media groups. The deaf people have not access to all of them. So you wonder how the government is going to help us, the deaf people, to understand clearly and have clear information about coronavirus. Why? Number one, we miss a lot of information. Sometimes the information that we share is not true. It's not right. It confuses us as the deaf people. And the information, when it comes back and then it shocks us, you hear another one is shocked, it's another is worrying. So from each one, you're shocked, which one is the right one? So the government should design information with the aim that is targeting to the deaf people, and then have clear information, not to panic, but receive correct, clear information so that we'll be able to protect ourselves very well. And we'll be able to help the government also reduce this corona spread.
All right. Generally, you will tell us the challenges the deaf people are facing. But allow me to ask you, you are a pastor, you are a business person, probably with the announcement of social distancing, with the announcement of now the curfew that people have to be home by 7 p.m. Probably personally as Henry, how did this affect you, business, and also, of course, your job as a pastor?
Yeah, it has affected us. Why? The deaf people, they are not highly employed, same as the normal people. Some of them work in low areas. What does it mean? The deaf people must work for long hours. If you tell them to go home early, this is going to affect their work. Example, me, in the evening, when I meet the deaf people, maybe we're preparing for worship, we're preparing for prayers, or we're preparing for fellowship together, but now it's impossible. So, when we need to meet, the time is not there. But I'm happy. Why? The deaf people are obedient. They go home early so that they can also protect themselves.
All right. And Henry, as a pastor, probably we've seen most people or pastors around the world using the online platform to send messages or preach to their congregation when they are at home. Probably, is that possible with you being a pastor? How are you reaching out to your congregation during days of worship?
In our church is integrated church. We have the deaf people who worship together with the hearing people. The first time Corona problem came, we had a home worship, but there was a lot of challenges. How we receive the word of God, how to fellowship and how to pray. So me and other leaders, we discussed and we asked our church, anytime that they're preaching online, also to include an interpreter. But I'm happy because it was accepted, so that the time they are preaching online, we also have an interpreter. So that the deaf also can follow from their own homes, for those who have access to internet, those who have access to technology, they are able to follow from home. But others who do not have, it's a challenge to them. But a more percentage is able to follow everything online.
All right, Henry, let's talk about the gap that you talked about that you're not getting. You highlighted that you're not getting this information on COVID-19 prevention very clearly. Let's highlight some of the gaps that you feel should be looked into by the government, even as they try to package these coronavirus prevention messages to the public.
What we request is maybe the government can include our deaf association, that is Kenya National Deaf Association. It's possible that they can work together. We have a deaf interpreter for the deaf, or maybe have a person who is receiving this information clearly communicate in our own language, which is sign language, where the deaf, this our language, we are able to understand it. Why? Some readings are so hard, but the sign you can easily understand. Number two, they develop simple materials, maybe papers, with signs, that when the deaf see the hand, they understand that they can understand, the deaf can protect themselves. Because now, when you see maybe the CS Health, just talk, but has an interpreter. But when you see, not all TV medias are able to, all of them are focused on the CS. The caption on the interpreter is so small, so a deaf person will miss a lot of information. But if they can focus also, and then later bring the deaf person, the interpreter, the deaf interpreter for the deaf, will explain much clearer when given time. Maybe this KBC and other media houses can give a deaf person time to sign and communicate, maybe around 7 or 9 to communicate, just given time. And I believe all the deaf in Kenya will be able to get clear and right information, and they're able to take preventive measures to put themselves. Yes.
All right, well said. You said that most of the times, if I'm not wrong, Lensa, most of the times for TV stations, the interpreter is usually almost invisible to the people with hearing impairment. So he's recommending actually that they focus on both the interpreter and the CS, because most of the stations focus on the CS alone. So let's talk about the impact of COVID-19 to the persons with hearing impairment economically. You mentioned that most of the deaf people with hearing impairment are not employed, so they are self-employed. Probably you can tell us the struggles as far as business and earning a living is concerned, Henry.
Yes, thank you for this very, very important area. Why employment for the deaf people is not high, it's low. What does it mean? If a company decides to close, who is going to suffer more? The deaf people. Why? Opportunities for the deaf people in Kenya is very minimal. For example, myself, I have education up to the university level, but people will not look at my qualifications. They look at my deafness. That's fine. And then, so what does it mean? If an opportunity is lost, getting another one is a problem. So what do we request? the employers should think about these deaf people. Yes, it's true that coronavirus has affected so many people, but in a special way, they should care for people with deafness. And also in the business for deaf people is affected. When people are worried, this place is not clean, how is it safe? The deaf people, their business is growing down. It's not growing because many people are concerned about corona.
All right. And you said that job opportunities for people with hearing impairment is minimal. Probably most of them, this means, are small-scale traders. With the curfew, with the imposition of the curfew that now employers or people have to be home by 7 p.m., this of course means that you have to struggle to get to your bus stop so that you head home. Probably you can tell us some of the challenges that you're facing to just ensure that you are home by 7 p.m.
For now, the information we received that helped us to care for ourselves, we are happy. The deaf people, they are obedient. The government order. We make sure that we are at our homes before 7 or earlier. But if a deaf person comes home early, it's impossible to do anything else. They cannot do any other business. For example, when deaf people are parents, they have children at home. Maybe these children, they started online education for children. But the deaf people, most of them cannot afford internet, to afford laptops. So the children stay home and they're doing a lot of nothing. The parents are very busy. The deaf parent is busy looking for money, but the children, they're staying at home suffering. It means this corona is affecting the deaf people in many, many different ways, more than the normal people.
Mm-hmm.
Yes.
All right, and I'm loving your passion you have towards the people with hearing impairment. Let me talk now to you, Henry. You are a pastor and you are a business person. Probably tell us, are your businesses still open or you've closed because of what is happening?
For now, my business is open, but taking preventive measures for both people who work there and also for those who come in as customers.
Mm-hmm.
Yeah.
So for you to take those preventive measures, because I do understand you have to ensure they wash hands regularly, sanitize use of masks. Probably how cost effective is that to you? And are those actually masks and sanitizers, are they available to you? Maybe you can talk about that.
Uh-huh. We have people who work there must have a mask. It's me who give them. And also as like their hand sanitizers. But I limit the number of people who come inside there. More than 2-3 people coming, I have noticed there. So the people, they look at the door and they see, because of corona, this shop requires what? Limited people, once. So it's helping me to keep myself safe, my workers safe, and also the safety of my customers.
Mm-hmm.
Yeah.
All right, let's talk about now Pastor Henry Maina at home. Probably first as a pastor, are you also doing the online messages to your congregation, or you've just decided to have them rest and listen to other pastors who have opted for online preaching?
No. We formed a Facebook group, WhatsApp group, where we share information and we encouraging messages. We also share information about corona. And this information, when we find this information is correct, and also we understand this message not only to cause fear or we misinformation, but we share. We have more than 3 groups. The aim is to share the word of God with other deaf people from Mombasa, Nairobi, Kisumu. We have ways to ensure, and we network together. using this social media. Yes.
All right, 2 more questions for you before I let you go. First, we've seen families, you know, at home, because once, for example, you're working, you're home with your children, actually. So what are some of the activities that you are doing to keep yourselves busy? And number 2, we are celebrating Easter. It's Easter weekend. What have you been up to as Henry Maina family?
First, I try to keep my children busy. They have their books. I make sure that I follow their education, their school. I know the schools are closed, but I don't just allow them to sit free, but I encourage them to continue reading. I network with their teachers. I ask them daily homework, their activities. There's a timetable. They also know that at home, other children are busy. What are they doing? Not only that, I also encourage them to read the Word of God, because I believe this word is very, very important. We hear so many people fear, they have a lot of fear, but they have something to encourage them. This holiday, this Easter holiday, true, as a family, we didn't celebrate it, but we're taking this time to stay together as a family and catch up together. The whole week we've been so busy, but today we're taking this time to bond as a family, sit together and catch up.
All right. Thank you so much. Actually, that's so positive. Like, take this time to stay together as family and catch up. Henry, I'll give you, we are winding up. Probably you can now say the plight or the plea of persons with hearing impairment, probably as the campaigns on prevention of COVID-19 continue globally and especially here in the Kenya. Probably you can tell us what the persons with hearing impairment expect from the government.
Thank you very much. To the deaf people, I understand very well that coronavirus affects any person, not African, Americans, the rich and poor, man, women, all of them are affected. So the deaf also want to be included in fighting against corona. What does it mean? When the government is giving a message and they're giving news on what is new, we want to include the deaf also. The government designs friendly materials, and also the deaf will also feel involved in this. And also, this involvement of the deaf interpreter for the deaf, maybe given time at 7 or 9, this deaf person in TV, in media houses, the deaf can follow and they can communicate well, and the deaf in all Kenya will receive this message true, and then they'll believe and they'll be able to be upfront in fighting this coronavirus.
All right, Henry Maina, thank you so much for that. We have to wrap it up, but it was such an informative. Manwa Eric is saying, I didn't actually imagine this is what they were going through. I now hope the government will do the necessary and at least also reach out to this community. That is one of our viewers watching and appreciating the message and, of course, the information from Henry Maina, a pastor, and at the same time, a business person here in Nairobi. Once again, Henry, thank you so much for coming. Thank you. Yes.
You're welcome.
My name is Purity. You said Purity is here.
Yeah, that's my sign name.
So that's my sign name.
Yes.
All right. Thank you so much for your kindness, Henry. And of course, I wish you all the best. I hope the government will really put that into consideration. Looking forward to having you once again in the show.
Thank you.
All right. And thank you all for watching our show tonight. It's been great really having your company from 9 o'clock till now, a few minutes to 10:30. Thank you so much. Have yourself a lovely night. My name is Purity Museo, and this lady seated next to me, Lensa Odinko, has been our sign language interpreter, both for the newscast and also for this special program. Good night and God bless.